And she lied to me. I mean, she lied to my face for 6 months. My sister is a fucking liar.
Gosh.
Did you just curse? It's how I feel.
Hey everybody, welcome back. We are taking on episode 11 of The Pitt tonight. This is 5 p.m. I am Dr. Todd, by the way.
I'm Allycia.
And we are excited to have you back again with us tonight. Just a quick reminder, I know the time is finally here. We are leaving next week for our Disney World vacation. Can't wait for that, but we will not have our regularly scheduled Pitt release next Saturday. We do apologize for that, but don't fret. When we get back, we will catch up. We will catch up quickly. So enjoy the little break. We are going to release some content, though, while we're gone. We're going to have some stuff pre-scheduled for that. So please consider checking that out. We'll see what, I don't know. We don't know what we're going to have in store yet. We'll see what we have time to do.
We did watch one episode. I think if we can get it edited, we'll get it out.
Yeah, we're going to get it out.
What was it?
Get it
It's going to hurt.
This is going to hurt.
Oh, that's what it was.
And then we're also going to try to have the first episode of ER, but we'll see.
We will try. That one's really long.
Yeah, we'll see. All right, well, getting into another episode here of The Pitt. Do you have any thoughts, comments, criticisms?
No.
Okay.
No, I don't.
You look radiant tonight.
No, thank you.
All right, guys, please consider hitting that subscribe button. Help us keep growing. It's been so much fun. Like, comment, all the things that you guys keep doing every week. Let's go.
Get it.
A little nod. You can go.
Oh, yeah. That's right. Her first patient seeing like that.
Yeah.
Everything else in her life is out of her control except this. She wants to go out on her own terms. Very few of us get to do that. I should pick up more patients.
You got it. Bury yourself in your work.
Yep. Back on the horse.
Did Adam ask you if you wanted to have sex?
Mel, I don't know if I can tell you.
Interesting. I wonder why.
Well, it's private.
Oh.
Look, it's really important that I know.
Why?
Because
She's worried about her.
You're definitely yelling.
Becca.
Maybe we should step outside for a minute.
Why won't you tell me?
Oh.
Why don't you get some air?
Mm-hmm.
Got an update for me?
I'm just checking in.
What are the chances of me getting out of here on time, do you think?
It's a few, Cap. We can handle this. Question is, will you let us? How you two getting along?
I can play nice for another 2 hours.
It's been hot and cold.
Yeah. Yeah.
You know, it's funny. I wore scrubs to the office for like the first time in years.
I got those for Christmas.
Yeah, and they're black scrubs. And I came downstairs and our daughter was like, "You look like the main actor from the show The Pitt." And I've never been prouder in my life. I was like, you know what? I do look like Noah Wiley. Just less hair and less face all over. But other than that, identical. In slightly different face, but other than that, identical.
Me, Doc, didn't know he was the real Doc until a few months in. He was keeping a secret life from me.
Oh.
By the way, thank you for everybody for telling us who this actor was.
Oh, yeah.
I recognize him from The Walking Dead.
I recognize him from Sons of Anarchy.
Yeah.
And give the kid a break. It says here it takes an hour to get an x-ray.
For Chris and Whitney's fucking thing all day.
You know, I take Lexapro. It helps with panic attacks, not just depression.
Promise? I'm fine.
No trauma, no fever, no history of hypercoagulable state. However, she did take a 15-hour bus ride from Orlando to Pittsburgh.
Which is a risk factor.
Yeah.
No need to worry. If it's positive, we can treat with a blood thinner.
Bueno, if there's something I learned, it's to stop worrying. Add a single moment to your life.
Dinner's up.
Jesus Christ, this was resulted 25 minutes ago. Sodium 112.
No, that's not good.
Oh, no.
We did have a similar situation of hyponatremia in season 1.
Oh, yeah.
But yeah, low sodium, risk of seizure below 120.
Slide trauma, a perforated diverticulitis patient, Howard, made it through surgery.
Oh, he made it through surgery.
The shortness of breath in South 16, he could totally decompensate. I'm hoping to catch another intubation before 7. One more gets me to 3 in my first week. Probably a record.
Probably a record.
You're supposed to pick up the stable patients in order.
Do you need a second opinion on that?
Oh.
Okay.
Yeah.
A girl named Kiki came into reception looking for you.
Kiki?
She Says she'll be in the park.
Yeah, great, thanks.
I remember that name, Kiki.
I don't remember Kiki.
Is everything okay?
Fantastic.
It's been Langdon this whole time.
Kind of hoping I would never see him again.
You know, maybe he's changed. When you got a sec, there's something.
Santos! I need you to pick up food poisoning in 12. Yeah, sure, why not? What? No snark?
Food poisoning. That's a good one. We could talk about that at the end. Do a little medical lecture on that.
Never said anything about wanting a boyfriend or even liking anyone.
That doesn't mean she hasn't thought about it.
And I don't want to think about my sister thinking about having sex. I mean, he used to say he didn't take advantage of her. Middle Hill just let it happen. Why didn't they tell me?
Well, maybe they didn't know about it.
So I know a lot of people made comments about this in the last episode that perhaps Mel is worried because of like this exact thing that maybe Becca's being taken advantage of. And I think that's a valid concern. When you're a parent of a child with special needs, you have that's a legitimate concern that you live with, is that they are likely going to be more vulnerable to being maybe preyed upon or
taken advantage
of. In many ways, right? It doesn't have to just be like sexually, right? It could be financially, it could be emotionally, physically. So this is a legitimate concern. And obviously with Mel being sort of the primary caregiver, if you will, like very legitimate concern here. So this is a tough one.
I agree.
No, I have durable power of attorney, but we did this thing called supportive decision making where she can make her own decisions.
Are you regretting that now, Mel?
My son, he's not moving.
I got a hot and unresponsive child. I need a room, Dana.
Trauma 2.
Oh, is he left in the car?
Oh, he's hot.
Has Micah been sick with a fever? No, he was fine all day. I found him in the car.
Pupils are sluggish but reactive.
His lips are blue, so no oxygen.
Airway is patent with low tidal volume. Let's set up for intubation.
How long was he in there? Maybe 15 minutes or 20. And the car was just unlocked.
Well, I mean, our cars are, well, in the garage, though.
So we're going to help him breathe with a tube. Rectal temp is 105.5.
Heat stroke.
Yep.
See if we have an Arctic sun that's not in use. We need all the ice we can get.
Yes.
And 105 seems to be one of those like threshold temperatures. You cross into more heat stroke.
Yeah.
Obviously, he's unresponsive, which is another symptom of that.
Heard you had a heart attack.
I did not have a heart attack.
Look, if he likes to push.
I know.
Do you think he's intentionally or?
I don't know.
Ogilvy, you want to get some air? Got a good case for you.
Might an intubation be required?
It's an unhoused patient I've treated on the street team.
Is that the one, Kiki, that she asked to come back?
I don't know.
That she couldn't get her to get help then?
When Adam asked you to have sex.
He didn't ask me. I asked him.
No signs of trauma, just alcohol on the breath.
Seems to have calmed down a bit.
And he was fighting us so hard we had to give 4 milligrams of Versed.
Versed's pretty good because it has a little bit of like, we'll say, amnesia. So like you end up, if you give Versed actually, so like if let's say you do something traumatic, like try to reduce a dislocation in the field or something, and you give Versed after that, they like won't remember even the reduction part because there's just a little bit of an amnesia period there. So it's great for situations like this because take a nice rest. They wake up, they don't really remember the situation.
It seems like that could be abused.
Well, I mean, there's a ton of medicines that could be abused. I mean, it's not this. I mean, look at
like sounds like a date rape drug. Is that what they use for?
No, they don't use Versed. I don't know. We're not even going to get into that.
Okay, all right. You don't want him to remember anything. Just give him a little bit of Versed.
Yeah.
Sorry.
I'm glad where your mind goes.
Roxy's gone.
Oh,
man. That was quick.
Chibati's with him. She needs a death note. I can't find McKay.
Have you seen McKay anywhere?
No.
Oh, she went to help her street patient.
And you know, its street name is Frank, and this shit is nasty and can lead to skin necrosis.
Never understood drug addiction.
Well, you need to try.
An intelligent person allows themselves.
Can make mistakes, heal themselves, take away the pain, hide from the abuse. Healers, not judges.
Shouldn't we go to the crosswalk? No? Okay, this is what we're doing. I see organization in my future.
Okay,
sorry.
what did she say?
They do it again.
They make you laugh.
They have like the scene that's kind of silly, and then they bring you right back to the reality, which is, I mean, it's skillful.
Yeah.
So much was said in that scene.
Really?
No, seriously, so much was said in that scene without a single line of dialogue.
Okay, what was said?
I mean, you saw just the comfort being offered by Robbie, the understanding of the grieving husband, the understanding that Javadi had to Dr. Robbie's look. I mean, it was really skillful writing, skillful acting, and all of that, because those are the moments. It's sort of the silence of the moment, but so much gets said. So I mean, I was really
You're very moved by that.
I was happy that there was no dialogue.
Okay.
Because I was watching, I'm thinking, if someone says something, that's going to screw this up.
I'm like, somebody needs to say something.
No, that's the thing about medicine. Sometimes you have to recognize that silence is the answer. And sometimes when you're with a patient, you have to recognize when silence is needed. You know, not every silence has to be filled. And so this was a perfect example of that. They knew, I mean, they did it beautifully.
Yeah. I wouldn't be able to handle that.
Uncle V, he's a student doctor here to help me. So what's happening with you?
My leg's getting stinky again.
Yeah.
I don't really remember her.
I know. I remember the name. Oh, what is that?
Is that an injection site? My plan is clean with saline antibiotics.
Meta honey to break down the eschar. And then?
Which is like the dead tissue over top the wound.
Okay.
Roberto, like Roberto Clemente.
Sorry, I don't know who that is.
Pittsburgh Pirate great.
Pirates Hall of Famer Roberto Clemente.
Oh, like he is.
He's not Roberto Clemente.
Oh, okay.
Well, I'm from Nebraska.
They're more football there in Nebraska. Cornhuskers.
All right, what happened to your elbow?
O'Neal Cruz hits a walk-off tater, right?
Got hit by a foul ball.
Oh.
Shit, you know, but then somebody fell on top of me.
Oh.
And I think I heard a pop, but hard to tell with all the screaming.
It's probably worth it to get the ball.
You're not one of those guys who steals balls from kids, are you?
I didn't steal this. I wouldn't do that. I would never do that. I would never do that.
Caught it fair and square, Santos.
He's like, what is she doing?
No.
Okay, yeah, you know what? We can put that
He's
on
not
the
gonna
ball.
let go of the ball.
No, thanks.
You're not taking the ball.
I think I will hold on to this.
And O'Neal Cruz is legit, so I would agree
You
with
see
him.
his
Sling,
elbow?
and then
Yeah.
you can hold on to the ball while we examine you.
Throw in an IV and start with 4 morphine.
No. I don't want to be knocked out.
Doesn't want to lose the ball.
I need to stay alert.
Okay. We will order you an
I
X-ray.
respect it. All right, hold on. Real quick, jump in there. This is not
God.
medical at all, but you guys may be aware by now that I'm a huge sports fan, all sports, frankly. And the closest I ever came to catching, I actually did catch a foul ball once. It was off the bat of Johnny Cueto, interestingly. He was a great pitcher, not known for his hitting, but he fouled a ball straight back. I happened to catch it. But here's the thing, like kind of like Santos is saying, there's nothing more there's nothing more disgusting than like taking a ball from a kid. Because at the end of the day, it's just a stupid baseball.
Yeah.
And so like that Phillies Karen lady who like there's the video of her going and taking the ball. Like, no, don't do that. So, but I remember catching the ball and then looking around like for a kid, and there was none. And I was like, okay, because then I felt kind of weird keeping it. But
So
I kept
you were an
it.
adult at this point?
Yeah, I was
Okay.
an adult at this point. And so I don't even know where the ball is now. Actually, my kids probably played with it. But I almost caught a home run ball off of the bat of Chipper Jones going back a ways. This is when I was more like fresh out of high school. And well, he hit the ball and it went over our head. So we were front row in left field. And it went over our head. And so we were standing up, turned around to watch it go over our head, or my head. And it hit like the concrete like awning or whatever of the second deck up, and then ricocheted back at my head. And all I could do like in a split second was move my head and get my hand up, and it smacked my hand and then bounced, like, and then like went over back onto the field. And then I can't remember who was in left field at the time, but he came over and got the ball, and he looked up at me and was like, "That hurt." The base or the player, the Reds, and as he threw the ball back into he didn't even give me the ball. So I was like, it did. I mean, it stung, but my pride probably hurt more than anything.
Yeah.
So anyway, all right.
This guy's not losing his.
Back, he's not from O'Neill Cruz. You're not going to lose that ball.
Temp is down to 103.5.
On way to 98.6.
102, we take mop the ice. Otherwise, we can overshoot and cause hypothermia.
Oh, okay. Yeah, you don't want to do that.
What does the CK tell us, Joey? Rhabdo from muscle breakdown can take out kidneys.
Muscle breakdown.
More concerned about his brain.
It's not real reactive.
That's not good.
I'll see you at fireworks.
Oh, I was going to watch fireworks with Adam and his parents.
Oh.
Park. They're picking us up. They go every year.
We always watch the fireworks together. I have your headphones.
Adam said he has extra.
But this is what you want.
I want to go now.
Well, I guess I could.
Bye now.
Who do you have to talk to when things aren't going so good? Friends? Family?
Actually, I don't really have.
Hey, McKay, where have you been?
It always happens
I
to
know, she
her.
always gets cut off.
Gone for 10 minutes
When
tops.
you're here, I need you to be here. And while you stepped out, Roxy died.
Oh.
Agents Correa and Russo. She needs to be looked at before we process her.
What's your name, ma'am?
Benita.
We're conducting a sweep at a restaurant. Right when the kitchen took off, she was shoved down some alley stairs.
Are these ICE agents?
I'm assuming.
Curtis, dude, what happened?
Medics had to sedate him to transport.
Could he have taken drugs?
If he did, they were not the performance-enhancing kind. He shot a 112.
That's the important part of this. God.
Any family we can contact?
I have no idea. We don't talk about that shit. How long is he gonna be here?
At least 3 or 4 hours.
Is it okay if I just come back around 9?
Great friend.
Yeah. He said we don't talk about that stuff. So clearly just, what were they, darts?
Golf buddies.
Oh, golf. Okay. I don't know why I thought darts.
Yeah.
Lower than usual, but we will fast track her.
Is there anyone you want us to call, Benita?
No phone calls.
What?
Está pasando atrás, amiga. Aquí está buscando a alguien.
No sé.
People are leaving.
Yeah.
Block the pain, that way you won't be sedated
Oh,
at all.
thanks, Doc. just give me a bullet to bite on.
Okay.
We just need to treat her.
Even if she's undocumented?
All patients, regardless of immigration status, have the right to emergency care under MTALA. Planters are downgoing.
All encouraging signs.
But I think she said Babinski down, so that is a good sign.
Okay.
'Cause if there's like upper motor neuron injury, then that can result in like a almost like a flaying, or is that the right word? Like a flaying out, or sort of like going the opposite direction as opposed to down.
Okay. On the foot.
Yeah.
You seriously won't let her make a phone call?
Not until she's processed.
Unbelievable.
Are they like trying to hide their identity? Is that why they have to keep wearing that scarf thing?
I think so.
I was wondering if I could get his parents' phone number.
No, red phone is for emergencies only.
This is kind of an emergency.
Yeah.
Sorry. Bye.
She lost her kid at home. Oh, she just looks guilty. Has anyone seen her cry?
She could be in shock.
People don't always respond to trauma the way you expect them to. Stay focused on the kid.
What was that foreshadowing?
Sots 87.
You having some pain again, Mr. Green? He was just waiting on his discharge meds, pain-free.
There's someone in the comments that said they thought his patient was going to be had something more serious going on.
So let's get 2 units of whole blood hung, please.
Good.
They were wheeling one out and wheeling one in.
Yeah. It's the life of an ER.
What about the aorta?
I didn't look at the aorta.
What did you present to?
Dr. Mohan?
So the rest of the ultrasound was normal.
I meant that the other kidney was wrong.
Oh.
8 centimeter AAA with massive free fluid.
Ruptured aortic aneurysm.
8 centimeter AAA. So they kind of said it in there, but AAA abdominal aortic aneurysm, 8 centimeter is very big. It's a silent killer, so ruptured aneurysm.
That's why he didn't have pain.
Yeah, well, like a AAA is not really going to be painful, but because when it ruptures, it pretty much is going to kill you.
Ooh.
Now, I guess if it's going to rupture in the hospital, that's
Yeah.
probably the best place to have it. We recommend screening pretty much any male over the age of 65 who's ever smoked. I think they did actually, I don't know where they got this data, but it was like if you'd smoked 200 cigarettes in your life, I think, or no, I'm sorry, it was 100 cigarettes. If you'd smoked 100 cigarettes, which I think is what, 5 packs or something, 20 cigarettes a pack, then you're eligible at age 65 for a screening. We do an ultrasound, which is a pretty easy non-invasive test. If it's normal, you don't have to screen anymore. If it's enlarged, surgery is usually considered if around 5.5, or if it's like growing rapidly when you're checking it, say on your scans, follow-up scans. So he had an 8 centimeters. So this was huge.
Okay.
Yeah, it's typically going to be silent. I suppose it could cause pretty severe pain, like in the active state of rupturing.
All right.
So I'm not sure. I mean, I don't know if the pain he was having was actually from the AAA.
Right.
I still would have
But he had
imagined
kidney stones.
Right. I still would have imagined the pain was from the kidney stones, because then he was pain free for a while.
Yeah.
But anyway, so interesting one.
Yeah.
Get screened if you've ever smoked or strong family history.
Yeah.
Okay, who wants to intubate?
Oh. Oh, no, it's his
Why?
patient. He's not.
Sure.
Oh, I actually feel bad for him.
Yeah. I mean,
No.
There's no certainty as to how much recovery Michael will have. His response over the next 24 hours will tell.
and that is also very true.
Yeah.
That first 24 hours is usually when you see the most recovery.
Yeah. I mean, I do agree the mom is acting odd.
I'm stabilizing the humerus.
Right after I supinate with traction,
This
Dr.
is
Whitaker
gonna
will
hurt.
quiet.
1, 2, 3.
Okay, flexing at the elbow.
He's not even phased.
Yeah, I mean, when you work in the ER, you probably aren't phased very often.
And nobody saw the AAA on ultrasound? Was this you?
No, goes me.
Prep for a thoracotomy.
Dr. Giovanni, why don't you glove up and show Dr. Shamsi why you belong in the ED?
Oh, jeez.
Rib spreader.
I don't need a rib spreader.
Sitinsky.
Like, what is she even?
Aorta's clamped.
Oh, she's trying to clamp something.
Yeah.
The aorta?
Aorta's empty.
Okay, Giovanni, get in there. Internal compressions, go.
That's the heart then that they're trying to pump. Okay.
Neuro's intact, so we'll do a posterior splint, a sling, and an ortho referral.
You know, I'm actually kind of impressed you did that without pain meds.
You know, last year I caught McCutcheon's 300th career homer, but another fan stole it from me. Promised myself I would never let that happen again.
Well, I'm already here.
Yeah, I kind
You
of had
said
a
everything.
handle.
Can you just fill out the trash?
Should probably finish it.
Well,
Okay, someone do this. I don't care who.
Oh. I left him in an awkward spot.
Yeah.
where's Mrs. Azarmendi?
She slept out.
Oh, she's gone.
Really good.
Strong radial pulse.
Moist lap pads, prep for transfer.
She's excited. Look at her. She was like
Can I go
smiling.
with you?
He's my patient.
Okay by me.
I'm sorry too. I should have asked Ogilvy if he'd check the aorta. It's my fault.
It is. Everything out there, that is the key. That is the difference between the best doctors and the ones that don't make it.
You're right. Maybe I just don't belong here.
Oh.
Please, for the love of God, can you just go wait over there in the room with your detainees so I don't lose any more patients or staff?
No problem, Doc.
Brenda, where are you going?
Oh no, no, she's not. Oh my god.
Don, she needs a sling.
It's only take a minute.
We're leaving.
Hey man,
What
you're
the
hurting her.
heck? Security.
Get your hand
What the heck? Oh, she's
I
filming it.
don't. Relax. We gotta go.
Call the hospital attorney again.
Can't believe this shit.
Can you at least tell us where you're taking them?
Well, this is an intense episode.
Okay. And hey, Emma, have you seen this patient?
Oh, I haven't.
Oh, she took off when those ICE guys arrested your nurse.
So she's not getting care
Yeah.
for a DVT that could go to
know.
her lungs and kill her.
Night off. I'll cover for you until I can find someone else to come in.
Down.
Mel is unraveling.
She's had a terrible season so far.
No.
There's some tension between you and Dr. Santos.
You two have history?
Was she not briefed on this?
Probably not.
I was a pretty big asshole. She called me out on some things that I wasn't ready to face, and I'm gonna talk to her. I just haven't found the right time.
Interesting that he didn't share with her the history of that. Like, he wasn't super, you know, I don't know.
Well, clearly I don't think everybody knows.
That's what it seems to be.
Yeah.
That maybe this, and maybe that was intentional, because I know some people had said in the comments that kind of debating the merits of why he kept his job.
Yeah.
Whether this was maybe reported. You know, obviously I think it was known that he had an addiction, and so he got the help he needed. I don't know if it was globally known that he actually stole or took patient medication.
Right. Because in the real world, that would probably would have been
more than
fired.
likely. More than
the
likely,
hospital wouldn't have wanted that liability.
I would
imagine.
Yeah, I can imagine that they would. So, but yeah, part of his recovery, though, I'm assuming contains, you know, complete honesty, and that was not the most honest conversation, but
yeah.
So, yeah.
But in order to maybe preserve his job.
I suppose.
Maybe.
It's complex.
Yeah.
She's a boyfriend. She didn't tell me about.
Is this like the hall of reflection?
Maybe.
And she lied to me. I mean, she lied to my face for 6 months. My sister is a fucking liar.
Gosh.
You just curse.
It's how I feel.
People got their own reasons for keeping secrets. Most times it's got nothing to do with you.
Yeah.
I've seen Elf 164 times. And now she's got a boyfriend, and they're going to fall in love, and they're going to get married, and I'm going to be completely alone.
Yeah, so this is
Yeah.
afraid that she's not going to be needed.
Learned a long time ago to quit feeling sorry for myself. Now come on, pity party's over.
Back to work.
Be happy for her. Look at it as a chance to move on with her life.
And these are your lungs.
I think there's...
Yeah, it's this part right here, this space right between your lungs. It's called the mediastinum. Enlarged. It is too wide.
From what?
Can't really tell from plain film. Could be any number of things.
Yeah, stop the bullshit.
It could be an enlarged thyroid.
Could be cancer.
Enlarged lymph nodes from an infection. It could possibly be a tumor.
You think I have lung cancer?
No, I don't see that. The cancer of the lymph nodes is called lymphoma.
Oh.
Of the aorta, which is this big artery that comes off the heart, which can get enlarged because of a weak spot in the wall, is to do a CT scan of your chest today.
How long does that take?
A few hours, couple hours.
You still gonna be here?
I would not feel good about riding if I rushed this.
Yeah, he's not riding tonight.
I think the labs are back on your COPD patient. Saw him in the rack.
Thanks.
Look.
Oh, is he gonna talk to her?
I want to say I'm sorry being an asshole on your first day. That was completely inappropriate, and if I could take back what happened, I would, but I can't.
And you've convinced everyone here that you've changed and you're owning up to your mistakes, and they welcome you back with open arms because you're still the golden boy, and I think it's bullshit.
Not everybody has.
Robbie hasn't.
No.
You should have lost your license and gone to prison. Been through?
My wife threatened to divorce me, okay? I almost lost my kids.
Yeah, that's what happens when you fuck up. Tell everyone here you stole drugs and got kicked out of the ED because of it. Until then, stay out of my way.
She knows now.
She heard.
Oh, I'm just checking her vital sign. Oh.
Where am I?
Oh no.
What did you do
Oh
to me?
no.
Was... oh no.
Was this just gonna end there?
I guess we are. Man, all right, so this
It's
was...
really stupid writing.
Really? Big episode. So, okay, so there wasn't like a ton of medicine-heavy themes in this episode. The medicine, you know, and they, by the way, I mean, they've done this throughout this series, through both seasons. There's been these episodes that are really medicine-heavy, and then there's these episodes where the medicine takes very much a backseat. Not that the medicine doesn't still come through, right? So we can still get introduced to different things, you know, the AAA, abdominal aortic aneurysm that ruptured. So we're getting introduced to things like that. But it's the other elements of the show that are really shining here. So you have really, really polarizing issues here. Obviously, you have the things going on with ICE, the distractions that is presenting with in the ER setting, in the hospital setting, patients fleeing, hospitals, nurses fleeing, patients being treated inappropriately,
Yeah.
staff. Kind of reminds me of there was that story several years ago where that nurse got arrested because the cops came in with a patient and demanded that this nurse like draw his blood or something to check, I don't know, his blood alcohol level maybe. I'm not sure. And then she refused, and then they like tackled her and arrested her or something.
Oh, wow.
So there's that kind of like, because inside the hospital you would like to think that this is sort of a sacred place where people who need help can come to get help and not have to worry. Kind of Dana mentioned that, I can't remember the name of the law, but that law that says that everybody is treated, anybody who has an emergent need is treated regardless of expectation of ability to pay. Right? So it doesn't matter if they're undocumented, they don't have insurance, whatever the case may be, they have to receive appropriate emergency care. And so she kind of referenced that. Obviously, there's that tense issue there with Langdon and Santos kind of finally having maybe a one-on-one.
Yeah.
So Santos kind of answered the question for us that hardly anybody actually knows that he actually stole medicine from patients from the hospital. I guess they know he maybe had a problem and needed to get help. That's a tough one. And I know in the comment section has been very divided on this.
Yeah.
And so recognize that it's a bit polarizing, and last thing I want to do is make anybody angry. But, I guess I kind of want to say is Santos doesn't get to decide what Langdon needs to do for some atonement, right? Like,
yeah,
that's not, and honestly, even if he did, she wouldn't matter to her. Like,
no.
So that's
and she didn't report him.
No, she didn't. You could break that down any which way you want and probably be right, I guess is what I'm trying to say. Like, it's all very complicated.
I mean, for me, at least, Langdon is getting help.
Yeah. So, and that's kind of like what he said. You don't have to accept my apology. And she does not, right? Like, she has no obligation to accept an apology from him.
You know what I was looking for? I was looking for him to thank her.
Yeah. I think it was not the best of apologies.
I don't think it was.
It was basically, I'm sorry that I was hard on you.
As the daughter of an addict he's deceased now, but he never once tried to get help like Langdon did. So that's admirable, in my opinion.
I don't know that I really have, I don't know that I can really dive into that because it's so complicated. And I don't know that we have the ability to really break that down on both sides. So I guess it's one of those things where you just have to kind of come up with your own opinion on that.
Yep.
And then, of course, we end the episode with another episode of violence towards healthcare workers. And this is common. Like, this show has done a good job of showing that time and time again. And you have this patient who's confused, made some bad decisions, maybe took some drugs, or certainly is intoxicated. And he's acting in a way. Now, you can imagine, like, let's play devil's advocate. If you woke up and you weren't sure where you were and somebody's like putting stuff on you or whatever, you probably would be pretty scared or confused, or maybe even think you were being assaulted or something. And
I remember thinking that when I was waking up from my wisdom teeth.
Yeah. And like
I remember I wanted to hit the nurse so bad. I didn't know that she was a nurse. I just remember, like, in my head, I was swinging my arm, but I wasn't really moving. Yeah. So, I mean, you'd be disoriented.
Yeah, so you get these disoriented patients, or even like dementia patients. So again, this is like really complicated because sometimes they may do something out of their right mind. Now, it doesn't make it okay, obviously. Like, healthcare workers shouldn't be subjugated to abuse and violence. But again, it can be complicated. But anyway, hopefully somebody sees and rushes in here and helps her. Because this guy's like trying to choke her out or something.
I know.
So yeah, anyway, I wrote down a couple of things that were more medically related. So I kind of jump into. I was hoping we'd actually get to see the food poisoning patient.
I know.
So we just
talked about it.
I know, because I could kind of dive into that. I don't know, again, because this is something I see in the outpatient world. So it's something that I find entertaining. And I guess the quick
entertaining.
Well, I find the science fascinating.
Yes.
So I guess the quick little thing on that is the onset of symptoms from food poisoning can tell us a whole lot about what the potential agents are, like what we potentially ate. Or if you tell us what you ate, then we can also kind of deduce perhaps what the organism is. And not all food poisoning is infectious. So I think that's kind of interesting. So probably the most common forms are from these preformed toxins that end up in the food. And so it's not the actual bacteria itself. It's actually, it will say it's a weapon of the bacteria that has found itself into this food.
Okay.
From improper handling and things like that. or not perhaps being kept at the right temperatures, this can happen. And these preformed toxins, then that's the reason that the onset of symptoms is so quick. So usually it's within hours of ingestion because that toxin starts wreaking havoc, but it comes on quick. It's usually gone fairly quickly. Probably the most common cause of this would be Staph aureus. So staph actually has a preformed toxin. There's also one called Bacillus cereus. We used to use the term B serious in med school to remember that. It can be from like reheated rice and things like that. And those are preformed toxins. So those aren't actually not infections. Those are just toxins that are doing the dirty work. Then you move down the ladder to like maybe true infections. And these are going to be bacteria that produce endotoxins inside the body. And those endotoxins then are what produces diarrheal symptoms, vomiting symptoms. E. coli is maybe a common example of this. And then they turn on these channels in the gut that produce a release excess like fluid. That's what causes us to have like that voluminous diarrhea along with the vomiting. And then of course you can get like dysentery. So if you've ever played Oregon Trail, you know, like half your crew dies of dysentery because of these infections, true infections. You can get things like, Campylobacter. I can remember that one being one. And then there's even things like Shigella or Salmonella can cause food poisoning. Interesting, Typhoid Mary. So if you remember the story of Typhoid Mary, so she actually had salmonella or typhoid she was a carrier. So it was like actually in her gallbladder as a carrier of it. So she didn't have symptoms of it, but she was producing these bacteria or shedding as she was, pooping. And then she was infecting lots and lots of people. So that's typhoid. That's a salmonella species. So anyway, interesting. And then of course, we talked about, they mentioned the patient that walked out due to ice who had likely had a DVT. Yeah. That's obviously very scary because DVTs, a blood clot in the calf is not particularly scary unless it propagates. And so the propagation would be that blood clot moves onward. And if it returns to the heart, then you can imagine as it returns to the right side of the heart through the venous circulation, if it pumps that out, it can go into the lungs. And that's where pulmonary embolism can be. And that can can be fatal, right? If you have a large PE. If you have a shunt in the heart, so like an ASD or something like a patent foramen ovale, then that blood clot can actually cross over the left side of the heart, go up to the brain, cause a stroke. And so that could be an issue. So sometimes if you have what's called cryptogenic stroke, where you're not sure what the source was, you can actually, sometimes I'll actually do an echo and do what's called a bubble study to look to see if it crosses over, see if they have that opening that needs to be closed because of that. And then, DVT, deep venous thrombosis, most of those are going to be the deep veins. They kind of hinted at this because she was in a 15-hour car ride. So this is more than likely going to be considered provoked. So in the world of medicine, we like to classify these as either provoked or non-provoked. So a provoked DVT means that we have an explanation for it. A non-provoked DVT means that there is zero explanation for why this person might have thrown a clot. Obviously, provoked is preferred because if you know how it happened, why it happened, then you feel pretty good about reducing the risk that it might happen again. And those people don't always need lifelong blood thinners. If it's unprovoked, technically, you're probably going to keep these people on blood thinners lifelong because otherwise you run the risk of having another one. But anyway, so that was some of the medicine stuff that happened in this episode. Yeah. All right. Any other thoughts?
No.
All right. Ready to get into the next one. But remember, give us 2 weeks. We'll have that out.
I can't believe we're going to have to wait 2 weeks.
I know. See what happens.
No. We have to stay off social media.
I don't think that's going to be that big of a problem while we're away. All right, guys. Thanks for checking this out with us. Consider coming back next time. Till then, have a good night.
See ya.
I am Dr. Todd.